Now come to the uterus. The uterus is a hollow muscular organ situated in the lesser pelvis. And the uterus is pear-shaped organ. This is the main organ of gestation, as because the implantation of blastocysts occurred in the uterine cavity, and the uterus holds the fetus up to the birth, and it gives the nutrition, protection and support to the fetus. Now come to the subdivisions of uterus and parts of uterus. Uterus is divided into three parts: fundus, body and cervix. At the junction of cervix and body is called the isthmus. So isthmus is a junction, and we have to know this in details in later in systemic discussion. Before this, we have to know the measurement of uterus. The uterus is 7.5 centimeter long. The body and fundus is 5 centimeter long, and the cervix is 2.5 centimeter long. And the thickness of the uterus is 2.5 centimeter. And now come to the peritoneal reflection of uterus. This is very important for gynecological purpose and surgical purpose. The peritoneum reflected from the conjoint ischiopubic ramus, then it covers the superior surface of the urinary bladder. Then it forms the vesico-uterine pouch. It forms the vesico-uterine pouch. Then it covers the body of the uterus, fundus, and then body of the uterus up to the posterior phonics. So anteriorly, the peritoneum is reflected at the isthmus, and posteriorly, the peritoneum is reflected up to the posterior phonics of vagina. And laterally, the peritoneum is hold together and form the broad ligament, and the lateral border of uterus is non-peritoneal, as because the attachment of broad ligament, and then it is reflected to the conjoint ischiopubic ramus. Now come to the position of uterus. As we know, the anteversion and anteflexion. First of all, anteversion. It is the forward angle between the axis of the cervix and axis of vagina. It is not seen in this viscera. So it is the axis between the axis of vagina and the axis of cervix form a 90-degree angle. This is known as anteversion. The anteversion position is essential for preventing the prolapse of uterus. And the anteversion is maintained by the forward pull of uterine fundus by the traction of the round ligament of uterus, backward pull of cervix by the traction of uterosacral ligament, and the intrinsic growth of uterine musculature. And the another term is anteflexion. The anteflexion is the forward angle between the body and the cervix at the isthmus. So here is the anteflexion. It is 125 degree, provided the bladder and rectum is empty. The anteflexion is essential to prevent miscarriage. Another term, dextro-rotated fundus. If the fundus is rotated to the right, then the cervix is rotated to the left. So it is known as dextro-rotated fundus. For your information, you have to know the dextro-rotation and levo-rotation takes around the anterior-posterior axis, and the anteversion and anteflexion occur in the transverse axis. Now come to the systemic discussion on the parts of uterus. The uterus is divided into three parts: fundus, body and cervix. And this is the fundus. The demarcating line of fundus is there is a imaginary line extends from the entrance of one uterine tube to the uterine cavity to the another entrance of uterine tube. So here is the fundus. Fundus has no uterine cavity. It is muscular in nature. Now come to the body. Below the imaginary line and above the isthmus, the structure is known as the body of the uterus. It has anterior and posterior surface. The anterior or vesical surface is flat and the posterior surface is convex, and it has two lateral border. This is lateral border and this is another lateral border, and two lateral angle known as cornua. This is the right lateral angle, this is left lateral angle. Now come to the discussion. The anterior surface or vesical, also known as vesical surface, as it is closely related to the urinary bladder, it is flat and directed downwards and forwards. It is covered with peritoneum. The reflection of peritoneum occurs up to the isthmus. And now come to the posterior surface. The posterior surface is convex and it is also known as intestinal surface, as it is related to the rectum and sigmoid colon. It directed upwards and backwards. If the anterior surface is directed downwards and forwards, the posterior surface is directed upwards and backwards. Now come to the lateral border. The lateral borders are rounded. This is non-peritoneal for the attachment of broad ligament of uterus. Come to the lateral angle, very important for the relation of lateral angle. Lateral angle is related to three structures. One is uterine tube, the uppermost structure, and this is the uterine tube, the uppermost structure. This is uterine tube, and below and in front it is related with the round ligament of uterus. This is round ligament of uterus, and below and behind it is related with the ligament of ovary or round ligament of ovary. This is round ligament of ovary. Now come to the structure of uterus. This figure shows the histological structure of uterus. The uterus consists of three courts. From outside inward, the outer periosteum, outer perimetrium, middle myometrium, and the inner endometrium. The endometrium again consists of lamina propria and lining epithelium. The lining epithelium is simple columnar epithelium, and the lamina propria is wide in nature. It contains numerous coiled tubular gland and numerous blood vessels. There is no submucosal layer. Then come to the muscle coat. The middle muscle coat is again divided into three regions: outer longitudinal, middle circular, and inner reticular. The muscle coats are interlacing in nature, and it is connected with the layers by elastic fibers. The inner layer is reticular in arrangement. So the term living ligature. The straight arteries pierces the musculature of the uterus, and when the rupture of these straight arteries occurs in case of menstruation and menstrual bleeding, then the uterus contract. When the uterus contract, the reticular muscle constrict the straight arteries. Then it helps in clotting of blood and it prevent hemorrhage. So this is known as living ligature of uterus. Now come to the perimetrium. Perimetrium derived from peritoneum of uterus. Where it is derived from peritoneum, it is covered by mesothelium. Where it is non-peritoneal, it is covered only by connective tissue. There is no mesothelium layer in case of non-peritoneal area. Now come to the endometrium. You have to know the types of endometrium and the layer of endometrium. Endometrium is divided into two layers. One is functional layer, another is basal layer. The basal layer is known as stratum basalis. The functional layer is another, again divides into stratum compactum and stratum spongiosum. The functional layer is called the functional layer because the functional change occur in the functional layer in case of the menstrual cycle. Is all about the structure of uterus. Now come to the cervix. Cervix is also part of uterus and it extends from the internal os. Internal os, the term came from the ostium, internal ostium. Ostium means any communication. The communication of the cervical canal with the uterine cavity is done with the internal os or internal ostium, and the part below the isthmus is called the cervix. So the isthmus is correspond to internal os. This is very paid question for viva. Isthmus is corresponds with internal os. And this part is the cervix, which is 2.5 centimeter in length. In the part of cervix has two parts, supravaginal part and vaginal part. The relation, the supravaginal part is related in front with the urinary bladder separated by loose parametric tissue, and this portion is non-peritoneal, and behind it covered with peritoneum with the pouch of Douglas. And the pouch of Douglas is the peritoneal pouch formed by reflection of peritoneum from the posterior surface of uterus to the rectum. And on each side, the uterus lies about 2 centimeter lateral to the cervix, the ureter. So the cervix is related to ureter, and the uterine artery crosses above and in front of the ureter. The vaginal part is not identified in this viscera, but for your knowledge you have to know. The vaginal part is conical in shape, and the blunt tip is raised on the posterior vaginal wall. So the cervix, vaginal part of the cervix is protrude on the vagina. So it forms a circumferential gutter which known as vaginal phonics. For your anatomical knowledge, the phonics is divided into 4 parts: the anterior phonics, posterior phonics, and lateral phonics. But as a whole, the phonics is a circumferential gutter formed by the protrusion of the cervix on vagina. Now come to the structure of cervix. The structure of cervix is all related with the structure of uterus, but it has 3 coats from outside inward: serous, muscular, and mucus. The serous coat derived from peritoneum, and where it is non-peritoneal, it is derived from connective tissue. And the muscular coat consists irregularly disposed smooth muscle, and it is more elastic than muscular. The mucous membrane of the cervical canal is lined by simple columnar epithelium. In case of supravaginal part, the vaginal part is lined by stratified squamous epithelium. Now there is a difference between adult female and the female before menarche. The female before menarche, the cervical canal, the mucous membrane of the cervical canal is lined by simple columnar epithelium with cilia, and by repeated destruction of the functional layer, the cilia are degenerates, and in adult cilia is not found. The cervical canal is fusiform in coronal section. It communicates above with the uterine cavity, and this is the uterine cavity. Communicate with the cervical canal in internal os. The palmate fold passes upward and laterally, resembling the branches of a tree is seen in case of cervical canal. These are called the arbor vitae uteri. Now come to the development of uterus and arterial supply of uterus. The body and the fundus of uterus is developed from the fusion of intermediate horizontal part of two paramesonephric duct. Paramesonephric duct is also known as Mullerian duct, and the cervix is developed from the upper part of the uterovaginal canal, which is formed by fusion of lower vertical part of two paramesonephric duct. So as a whole, the uterus developed from paramesonephric duct. The fundus and body is developed from the fusion of intermediate horizontal part, fundus and body from horizontal part, and the cervix and vagina, both cervix and vagina is developed from uterovaginal canal, which is formed by fusion of two lower vertical lower vertical part of paramesonephric duct. Now come to the arterial supply. The uterus is supplied mostly by uterine artery, branch of internal iliac artery, and it also supplied by ovarian artery, which is branch of abdominal aorta. You have to know the mode of arterial supply. Now come to the mode of arterial supply. Uterine artery arises from internal iliac artery. Then it crosses above and in front of the ureter from the lateral to the medial side. It ascends upward through the broad ligament of uterus. So along the broad ligament of uterus, it ascends upward, and it anastomoses with the ovarian artery close to the cornua. And when ascends, it gives some branches. Close to the isthmus, it gives the ureteric, vaginal and cervical branches. The cervical branches form the circular anastomosis around the isthmus. This is not so important, but when it ascends upward through the broad ligament, it gives coronary or arcuate branches. These are the coronary or arcuate branches. This is uterine artery, and this is the broad ligament. Through the broad ligament, uterine artery ascends upward. The uterine artery gives arcuate or coronary branches. These are the coronary or arcuate branches. Each coronary or arcuate branches anastomosis with the coronary or arcuate branches of the opposite side, and this is the right side, and this is the arcuate branches of left side, and this is right side. The anastomosis at the median plane. Anastomosis occurred at the median plane. From arcuate branches, numerous radial branches arises, and which pierce the perimetrium and the myometrium. In the middle layer of the muscle, middle circular layer of the muscle, the radial branches form the extensive vascularity, and it is known as stratum vasculari, and this is the stratum vasculari. It occurs within the middle circular layer of uterus. From stratum vasculari, basal arteries arises. Basal artery, and this is a basal artery, this is basal artery, and basal branches arises. Basal branches has two types of branch. One is spiral artery and another is basal artery proper. This is basal artery proper, and this is spiral artery. Spiral artery supplies the functional layer, and basal artery supplies the basal layer of the uterus. This is the mode of the arterial supply of uterus. Very paid question for both viva and. Come to the venous drainage. Venous drainage corresponds to artery. So the venous drainage of uterus is drained by uterine vein and ovarian vein. Come to the lymphatic drainage. Lymphatic drainage also important for uterus. The lymph vessel of uterus consists of three intercommunicating plexus. One is submucous, one is intramuscular, and another is subserous. From subserous plexus, the lymphatic drain as different regions. From the fundus and upper part of the body, most of the vessels drain into pre-aortic and lateral aortic lymph nodes, and few vessels are from lateral angle drains into superficial inguinal lymph node. From the lower part of the body, most of the lymphatics drain into external iliac lymph node. From the cervix, on each side, the lymphatics drain into three directions. This is very important, that lymphatics drainage of cervix. Laterally, some vessels pass through the parametric tissues, drain into external iliac and obturator lymph nodes. Posterolaterally, the lymphatics pass along the lateral pelvic wall, drain into internal iliac nodes. Posteriorly, the lymphatics drains into sacral lymph nodes. Now come to the nerve supply. The uterus, as it is a viscera, it has autonomic nervous supply, autonomic nerve supply. The autonomic nervous system has two parts, sympathetic and parasympathetic. The sympathetic supply is derived from 12th thoracic to first lumbar spinal cord segment, and the parasympathetic supply arises from pelvic splanchnic nerve. Now come to the ligaments of uterus. Uterus is supported by some ligaments, and these ligaments are, some are false ligament and some are true ligaments. The In associated question in Viva board, you may be asked what are the difference between true ligament and false ligament. True ligament is called true ligament because it is formed by the fibromuscular tissue or fibroconnective tissues, and the false ligament are the fold of peritoneum. The uterus has 8 true ligament and 6 false ligament. All the true ligaments are paired, and these are the round ligament of uterus, the McEnroe's ligament, the uterosacral ligaments, and the pubocervical ligaments. All of them are paired. These 4 ligaments are 8 in number. Now come to the false ligament. False ligament are fold of peritoneum, uterovesical fold, which also known as anterior false ligament, uterovesical fold. It is related, formed by reflection of peritoneum from the anterior surface of the body of the uterus to the upper surface of the urinary bladder at the level of isthmus. So here is the uterovesical fold. The recto-vaginal fold, posterior false ligament. This is the recto-vaginal fold, and a pair of recto-uterine fold, and a pair of broad ligament. We have to identify the structures, and this is the round ligament, and this is the round ligament of uterus. This is a true ligament, and another is McEnroe's ligament. It is condensation of parametric tissue extended from laterally from the cervico-vaginal junction. So it is not seen in viscera. Also known as cardinal ligament, the McEnroe's ligament. Now come to the uterosacral ligament. Uterosacral ligament is important for anteversion and anteflexion structure. Uterosacral ligament. This also lost from this viscera, uterosacral ligament. Now come to the pubocervical ligament. This is a pair of thin fibrous bands extend from the cervix to the pubic bones. Here is the cervix to pubic bones. Here is the pubocervical ligament. Come to the false ligament. This is uterovesical fold. This is recto-vaginal fold, recto-uterine fold. This is recto-uterine fold. This is recto-uterine fold. 2 recto-uterine fold. 1, 2 on each side, and a pair of broad ligament. These are the broad ligament. This is a broad ligament. This is a broad ligament. Now, broad ligament is very important as it is a fold of peritoneum. It has presenting parts. Broad ligament is subdivided into 4 parts. One is mesosalpinx, another is mesometrium, another is mesovarium, another is suspensory ligament of ovary. The broad ligament, it has 4 parts. The mesosalpinx. Salpinx means the uterine tube. So the broad ligament attached to the uterine tube known as mesosalpinx. The broad ligament attached to the mesovarian border of ovary. The broad ligament attached to the mesovarian border of ovary known as mesovarium. The broad ligament attached to the lateral border of uterus known as mesometrium, and the suspensory ligament of ovary, also known as infundibulopelvic ligament, is a triangular fold which connects the ovary with the uterine tube. This is the suspensory ligament of ovary. And here, this is suspensory ligament of ovary. Now comes the support of the uterus. Uterus is holded in the right position by some support as muscular support, ligamentous support, visceral support, loose packing materials. The muscle which support the uterus extensively is the levator ani muscle. The levator ani muscle is the muscle of pelvic diaphragm, and the pelvic diaphragm is prevent the tendency of descent of uterus from above downward. The U-shaped puborectal sling of levator ani muscle maintain the forward curvature of anorectal flexure, upon which the sloping posterior wall of vagina rests. The another muscular support is perineal body. It is pyramidal in shape. Fibromuscular node intervenes between vaginal canal and anal canal. The paid question: what is gynecological perineum? The integrity of the pelvic floor is maintained by the perineal body. If the perineal body is torn during childbirth, not properly repaired, the urogenital hiatus becomes enlarged. The vagina dilates and the uterus descends. Therefore, the perineal body is considered as gynecological perineum. It must be guarded properly during vaginal delivery. Come to the ligamental support or ligamentous support. The main ligamentous support came from the McEnroe's ligament, which retain the cervix in median position and prevent the descent of uterus. The another thing is the round ligament of uterosacral ligament maintain the anteversion and anteflexion position. The visceral support. The visceral support is formed by the anorectal flexure, upon which this is the anorectal flexure, upon which the posterior part of vagina rests. And another thing is the superior surface of bladder act as platform for rest of the anterior surface of uterus. The another thing is loose packing materials. The loose packing materials around the uterus is known as parametric tissue, not perimetric. It is parametric tissue. The parametrium or parametric tissue makes the uterine body mobile, but it restricts the movement of cervix.